Hi there. Did you know around 3,200 people are diagnosed with cervical cancer in the UK each year? A cervical screening is an examination of the cervix and it's the only way to check that it is healthy. The cervix is the opening to your womb and it's made up of tiny cells which change over time. They may turn into cancer cells.
Is your age 25 to 49? Practitioners will send you a letter every 3 years and between 50 to 64 every 5 years, asking you to make an appointment for a cervical screening.
The cervical screening will take a few cells from your cervix and look for a virus called human papillomavirus, or HPV. Most women will get the virus at some point in their lives and may not even know they have it. You can get the virus from any kind of sex or sexual touching that involves another person. Children are offered an injection when they are 12 or 13, which helps protect from HPV. Going for a cervical screening is important, even if you had the injection when you were younger. The cervical screening is usually done by a female nurse or doctor. You can ask that a woman does your test when you book your appointment. Some of the common barriers associated with screening include feeling embarrassed, being too busy to attend, or feeling scared. You can discuss this with your nurse or doctor before they do the test.
The letter will come with a leaflet that explains about cervical screenings. You might want to read these by yourself or ask someone you trust to read through the letter and leaflet with you. They may be able to answer any questions you have. Your appointment will probably be at your doctor's surgery. You should try and book the appointment for a day when you are not having your period. So the day has come for you to go for your cervical screening appointment. If you are worried or need support, it's okay to take someone with you. Don't worry about the coronavirus. You will only be invited if it is safe to do so. When you arrive at your GP practice, go to the reception and show them your appointment letter so that they can book you in. You will be asked to take a seat in the waiting area. You will then be called in by the doctor or nurse. They will talk you through the process as they go along. You can ask questions on anything you're not sure about. You will need to undress behind the screen from the waist down. You will be given a sheet to put over yourself. They will ask you to lie back on the bed with your feet together as close to your bottom as you can get them, legs slightly bent and your knees apart. They will then start the test. They will put something called a speculum into your vagina to help see your cervix and then use a small, soft brush to take the sample. Don't worry, this doesn't hurt. It may just feel a little uncomfortable. Once this has been done, you can get dressed. Your results are usually sent to you in a letter within 2 weeks. Keep an eye out for them. If it is longer than 2 weeks, try not to worry. It doesn't mean anything is wrong.
Cervical screening is available to anyone between the ages of 25 to 64 with a cervix. Book your test at your local GP surgery if you haven't had a smear test in the last 3 or 5 years, depending on your age. Ask your loved ones if they had their cervical screening test and encourage them to go if not.